A healthy 68-year-old woman went for a routine checkup. She had no symptoms, no pain, nothing felt wrong. Yet, 2 weeks later, she was scheduled for surgery. Months afterward, her doctor admitted the procedure probably wasn't necessary. If you're over 65, this can happen to you too. Because some medical tests that sound life-saving can sometimes lead to unnecessary treatments, complications, and stress. In this video, I'll reveal 5 common tests older adults should question before agreeing to them, and why many experts now recommend a more careful approach. Let's begin. Test number 1, PSA screening for prostate cancer. Let me tell you about a man I'll call Robert. Robert was 71 years old and, by most people's standards, in remarkably good health. He played golf twice a week. He enjoyed long walks with his wife. Every Sunday, without fail, he cooked dinner for his children and grandchildren. Life wasn't perfect, but it was full. Then, during a routine checkup, his doctor suggested adding one more test to his blood work, a PSA test. Now, if you've never heard of it before, PSA stands for prostate-specific antigen. It's a protein produced by the prostate gland, and higher levels can sometimes be associated with prostate cancer. The test itself is simple, just a small blood sample. But what happens after the result comes back can sometimes become far more complicated. A few days later, Robert received a phone call. His PSA level was elevated. Not dramatically high, not an emergency, just higher than expected. Still, hearing the words "possible cancer" instantly changed the way he thought about his future. Suddenly, he wasn't thinking about golf or family dinners anymore. He was thinking about hospitals, surgeries, and whether something serious had been growing inside him without his knowledge. His doctor referred him to a specialist. The specialist recommended a biopsy. The biopsy found a tiny area of prostate cancer. And that's where many older men find themselves standing at a difficult crossroads, because hearing the word cancer naturally creates fear. Most people assume cancer must be treated immediately, remove it, destroy it, do something. But prostate cancer is unusual. Many prostate cancers found in older men grow extremely slowly. In some cases, so slowly that they never cause symptoms, never spread, and never become life-threatening during a man's lifetime. That doesn't mean prostate cancer should be ignored. Some forms are aggressive and absolutely require treatment. The challenge is determining which cancers are dangerous and which are not. Unfortunately, once a cancer is discovered, many patients feel pressured to act quickly, even when there may be time to consider other options. Robert chose surgery. The operation was technically successful. The cancer was removed. But the story didn't end there. Recovery took longer than expected. He experienced urinary problems that affected his confidence and independence. Activities he once enjoyed became more difficult. And while he was grateful the cancer was gone, he often wondered whether the treatment had improved his life, or simply exchanged one problem for another. This is exactly why many medical organizations have become more cautious about routine PSA screening in older men. The concern isn't the blood test itself. The concern is what can happen afterward. An elevated result may lead to more testing. More testing can lead to biopsies. Biopsies can lead to treatments, and treatments carry real risks, especially after age 70. That's why experts increasingly emphasize individualized decision-making rather than automatic screening for everyone. So if your doctor recommends a PSA test, don't be afraid to have a conversation before agreeing. Ask, what will this result change about my care? If the number comes back elevated, what options would I have? Would monitoring be reasonable before considering treatment? And considering my age and overall health, how likely am I to benefit from finding a slow-growing cancer? Those questions are not challenging your doctor. They are helping you make an informed decision. Because the goal isn't simply to find more disease. The goal is to protect your health, preserve your quality of life, and make choices that genuinely benefit you. And after age 65, those are not always the same thing. Test number 2. Colonoscopy after age 75. For years, we've heard the same message: get your colonoscopy. And for many adults, that's excellent advice. Colon cancer screening has saved countless lives by detecting cancer early or preventing it altogether. But after age 75, the conversation becomes more complicated. Let me tell you about a woman I'll call Eleanor. Eleanor was 78 years old, independent, active, sharp as ever. She volunteered at her local library twice a week, drove herself everywhere, and rarely missed a family event. 10 years earlier, she'd had a colonoscopy. The results were completely normal. No cancer, no concerning polyps, nothing that suggested a problem. So when her new physician recommended another routine colonoscopy, Eleanor didn't think twice. After all, she'd always followed medical advice. If screening was good at 68, surely it was good at 78, right? A week before the procedure, she began the bowel preparation. Anyone who's gone through it knows it isn't pleasant, but for older adults, it can be more than uncomfortable. It can be physically stressful. Over the next 24 hours, Eleanor became weak and dizzy. She struggled to keep fluids down. By the following morning, she was so dehydrated that her daughter took her to the emergency room. Instead of preparing for a routine screening, she spent 2 days in the hospital receiving intravenous fluids. Eventually, she recovered enough to undergo the colonoscopy. The procedure itself went smoothly. No cancer, no significant polyps, no serious findings at all. In the end, after days of preparation, hospitalization, anxiety, and recovery, the test revealed exactly what her previous screening had suggested a decade earlier. She was fine. Now, this doesn't mean colonoscopies are bad. Far from it. For many adults between ages 45 and 75, colonoscopy remains one of the most effective cancer screening tools available. The important question is whether the benefits remain the same as we grow older, and often they do not. Here's why. A screening test only makes sense when the potential benefit outweighs the potential risk. As we age, that balance can begin to shift. A colonoscopy is not simply a quick camera examination. First comes the bowel preparation. For older adults, the preparation itself can sometimes lead to dehydration, weakness, dizziness, and electrolyte imbalances. Then comes sedation. While generally safe, sedation may carry greater risks for older individuals, especially those with heart disease, lung conditions, or memory problems. And although uncommon, complications such as bleeding or bowel perforation become more concerning as the body becomes less resilient with age. This is one reason many medical organizations now recommend a more individualized approach after age 75. Instead of automatically scheduling another screening because a certain number of years have passed, doctors are encouraged to consider the whole person: your age, your overall health, your previous colonoscopy results, your life expectancy, and whether finding a slow-growing cancer would realistically change your future health. There's another important distinction many people miss. We're talking about screening colonoscopies, not diagnostic colonoscopies. If you're experiencing symptoms such as blood in the stool, unexplained weight loss, persistent abdominal pain, or major changes in bowel habits, that is a completely different situation. Symptoms always deserve medical attention. But when someone feels well, has no symptoms, and has a history of normal results, the decision becomes much more nuanced. That's why asking questions is so important. Before agreeing to another routine colonoscopy, consider asking, given my age and medical history, how much am I likely to benefit from this screening? What specific risks does this procedure carry for someone my age? Are there lower risk screening options available, such as stool-based tests? And based on my previous results, would waiting or monitoring be a reasonable choice? These questions don't mean you're refusing care. They mean you're making sure the care you're receiving is truly right for you. Because good medicine isn't about doing every test possible. It's about choosing the tests that offer the greatest benefit with the least risk. And after age 75, that's a conversation every patient deserves to have. Test number 3, routine full-body CT scans and whole-body imaging. Let me tell you about a man I'll call David. David was 73 years old, retired, healthy, the kind of person who believed strongly in prevention. He exercised regularly, watched what he ate, and never missed an annual checkup. One day, he saw an advertisement for a full-body CT scan. The promise was simple: find hidden problems before they become serious. The message sounded reassuring. Why wait for symptoms when modern technology could look inside your body today? For a few $100s, David booked the scan. He expected peace of mind. Instead, he began a medical journey that lasted nearly a year. A week after the scan, he received a report. Most of it looked normal, but one sentence caught his attention. A small nodule had been detected in one of his lungs. The report didn't say it was cancer. It didn't even say it was dangerous. It simply recommended further evaluation. Naturally, David became worried. His doctor ordered another scan. The second scan showed the same tiny spot, still inconclusive. A specialist was consulted. More imaging followed. Then discussions about whether a biopsy might be necessary. Month after month, David found himself waiting for appointments, reading frightening information online, and imagining worst-case scenarios. His sleep suffered, his anxiety grew, his family worried. And after nearly a year of follow-up testing, the final conclusion was reached. The nodule was harmless. It always had been. Nothing needed to be treated. Nothing needed to be removed. The finding had never posed a threat to his health, yet it had consumed months of his life. Unfortunately, stories like David's are not uncommon, and they illustrate a problem that many people have never heard of. As we age, our bodies naturally accumulate small abnormalities, tiny cysts, small nodules, minor irregularities, little spots and shadows that appear on imaging tests. Radiologists even have a name for these unexpected findings: incidentalomas. An incidentaloma is something discovered by accident while looking for something else. Most of the time, these findings are completely harmless. They don't cause symptoms, they don't affect quality of life, and many would never be discovered if the scan had never been performed. The problem is that once something appears on a scan, it becomes very difficult to ignore. Doctors cannot simply assume every spot is harmless. They have a responsibility to investigate. So one scan often leads to another. Another scan may lead to a specialist. A specialist may recommend additional imaging. And occasionally, invasive procedures such as biopsies become part of the process. This phenomenon is sometimes called the cascade effect. One unexpected finding creates a chain reaction of tests, appointments, procedures, and worry. And often, that entire chain begins with something that was never dangerous in the first place. Now, it's important to understand something. Medical imaging can be incredibly valuable when symptoms are present. If someone has unexplained pain, significant weight loss, concerning neurological symptoms, or another specific medical problem, imaging can help identify the cause and guide treatment. That's not what we're talking about here. We're talking about full body scans performed on people who feel well and have no symptoms. For those individuals, major medical organizations generally do not recommend routine whole-body CT screening. The reason is simple: the risks often outweigh the benefits. There's another issue that receives far less attention in advertisements: radiation exposure. CT scans use ionizing radiation to create detailed images of the body. One scan may not seem like a big deal, but repeated scans over many years increase cumulative radiation exposure. While the risk for any individual scan may be relatively small, unnecessary exposure is still something worth avoiding whenever possible. And perhaps the biggest cost isn't physical at all, it's emotional. Many people purchase these scans hoping for reassurance. What they often receive instead is uncertainty. A harmless shadow becomes months of stress. A tiny nodule becomes endless worry. A search for peace of mind becomes a source of anxiety. I understand the appeal. As we get older, we want certainty. We want to know that everything inside us is okay. That's a natural human desire. But more information is not always better information. Sometimes, seeing everything creates new questions without providing useful answers. That's why it's important to ask thoughtful questions before agreeing to any imaging test. Ask, do I have symptoms that make this scan medically necessary? What specific condition are we looking for? If the scan finds an incidental finding, what would the next steps be? And is there a safer or more targeted test that could answer the same question? Those questions can help you avoid unnecessary procedures, unnecessary anxiety, and unnecessary risks. Because the goal of good healthcare isn't to find every tiny imperfection in the body. The goal is to find problems that truly matter and treat them when treatment will genuinely improve your life. Test number 4. Aggressive cardiac stress testing without a clear reason. When we talk about health after 65, heart health deserves serious attention. Heart disease remains one of the leading causes of illness in older adults. That's why monitoring blood pressure, managing cholesterol, staying active, and paying attention to symptoms such as chest pain, shortness of breath, or unusual fatigue are all incredibly important. But there is an important difference between evaluating symptoms and ordering tests simply because someone has reached a certain age. Let me tell you about a man I'll call Harold. Harold was 74 years old, retired, active, not a marathon runner, but healthy enough to enjoy long walks with his wife, work in his garden, and play with his grandchildren. Like many people his age, he occasionally felt tired at the end of the day. Nothing unusual, nothing alarming. During an annual physical, his doctor suggested a cardiac stress test, not because Harold had chest pain, not because he had fainted, not because he was experiencing any serious symptoms. The test was ordered largely as a precaution, just to be thorough. Harold agreed. After all, who wouldn't want to make sure their heart was healthy? A few days later, the results came back. Not normal, but not clearly abnormal either. The report used a word many patients have never heard before: equivocal. In simple terms, it meant the test had not provided a clear answer, and that uncertainty became the beginning of a much larger journey. Suddenly, Harold was no longer thinking of himself as a healthy retiree. Now he was wondering if something might be wrong with his heart. His doctor referred him to a cardiologist. The cardiologist reviewed the results and recommended additional testing. More appointments followed, more discussions, more waiting. And eventually, a cardiac catheterization was suggested. For those unfamiliar with the procedure, cardiac catheterization involves threading a thin tube through a blood vessel and into the heart to look for blockages in the coronary arteries. It can be an extremely valuable test when there is a strong reason to suspect heart disease, but it is not risk-free. Like any invasive procedure, it carries potential complications: bleeding, damage to blood vessels, kidney problems related to contrast dye, irregular heart rhythms, and in rare cases, more serious cardiovascular events. Harold spent weeks worrying about what doctors might find. He found himself paying closer attention to every heartbeat, every moment of fatigue, every minor ache. The test that was meant to reassure him had instead created anxiety. Eventually, the procedure was completed. The results? His arteries showed mild age-related changes. Nothing unexpected, nothing requiring surgery, nothing requiring a stent, nothing that explained a serious problem. The final recommendation was simple: continue exercising, continue taking prescribed medications, continue living the healthy lifestyle he was already following. In other words, after months of appointments, stress, and invasive testing, Harold ended up exactly where he had started. Now, this doesn't mean stress tests are unnecessary. Far from it. For someone experiencing chest pain, unexplained shortness of breath, dizziness during exercise, or other concerning symptoms, stress testing can be extremely helpful. In the right situation, it can identify serious heart disease and potentially save lives. The concern arises when testing is performed routinely in people who feel well and have no clear indication for it, because no medical test is perfect. Sometimes results fall into a gray area, not clearly normal, not clearly abnormal. And once that happens, additional testing often follows. What began as a simple precaution can gradually become a series of increasingly complex procedures. The question isn't whether heart disease matters, it absolutely does. The question is whether a particular test is likely to improve your health enough to justify its risks. That's a conversation worth having before the first appointment is scheduled. If your doctor recommends a cardiac stress test, consider asking, what symptom, concern, or risk factor makes this test necessary for me? How likely is this test to change my treatment plan? If the result is unclear, what additional tests might follow? And what are the risks and benefits of those next steps? These questions are not about avoiding medical care. They are about making sure every test has a clear purpose. Because the best healthcare is not the healthcare that performs the most tests. It's the healthcare that performs the right tests for the right reasons at the right time. And that becomes especially important as we grow older. Test number 5. Bone density scans leading to unnecessary medication. Let's talk about bone health, because unlike some of the other tests we've discussed today, this one starts with a very real concern. As we get older, our bones naturally become less dense, and when bones become too weak, the consequences can be serious. A hip fracture at age 70 or 80 isn't just a broken bone. For some older adults, it can mean surgery, loss of independence, months of rehabilitation, or a permanent change in quality of life. That's why bone health matters. And that's why bone density scans, commonly called DEXA scans, can be valuable tools. They help doctors estimate fracture risk and identify people who may genuinely benefit from treatment. The problem isn't the scan. The problem is what sometimes happens after the scan. Let me introduce you to a woman I'll call Dorothy. Dorothy was 69 years old, healthy, independent. She enjoyed gardening, walking with friends, and spending weekends with her grandchildren. During a routine checkup, her doctor recommended a bone density scan. The test was quick and painless. A few days later, the results came back. Her report showed something called osteopenia. Now, when Dorothy heard that word, she immediately became worried. It sounded serious. It sounded like the beginning of osteoporosis. It sounded like something that needed treatment right away. Before she fully understood what the diagnosis meant, she was handed a prescription. And that's where many people find themselves. Because osteopenia and osteoporosis are not the same thing, osteoporosis means bones have become fragile enough that fracture risk is significantly increased. Osteopenia is different. It simply means bone density is lower than average. In fact, osteopenia is extremely common as people age. Millions of older adults have it, and many will never experience a fracture related to it. That's why one bone density number rarely tells the whole story. Age matters. Family history matters. Previous fractures matter. Balance problems matter. Activity level matters. Overall health matters. A person's fracture risk is determined by far more than a single scan result. But sometimes that distinction gets lost. The scan shows osteopenia, the prescription follows, and the conversation ends there. Dorothy trusted her doctor and began taking the medication. Year after year, she continued. She never questioned it. Why would she? She assumed the medicine was necessary. Then, during a visit with a different physician several years later, she asked a simple question. How much is this medication actually helping me? The doctor reviewed her records, her medical history, and her overall fracture risk. What Dorothy learned surprised her. For someone with her specific risk profile, the potential benefit of medication was relatively modest. Meanwhile, regular weight-bearing exercise, adequate calcium intake, vitamin D, strength training, and fall prevention strategies could have played an equally important role in protecting her bones. No one had ever fully explained those options. She wasn't angry. She didn't feel betrayed. She understood her doctors were trying to help. What bothered her was something else. She wished she had been included in the decision. She wished someone had taken the time to explain the difference between having a number on a report and having a truly high fracture risk. Now, to be clear, medications such as bisphosphonates can be extremely helpful for the right patient. For individuals with true osteoporosis or a high risk of fracture, these treatments can significantly reduce the likelihood of serious bone injuries. This isn't about rejecting medication. It's about making sure medication matches the level of risk. Because every treatment has potential downsides. Long-term use of certain osteoporosis medications has been associated with rare but serious complications, including unusual thigh bone fractures and a condition called osteonecrosis of the jaw. These complications are uncommon, but they illustrate an important principle. Every medical decision involves balancing benefits against risks, and that balance is different for every person. That's why many experts now encourage a more individualized approach, rather than focusing on a bone density number alone. The goal isn't simply to treat a scan result. The goal is to reduce the likelihood of fractures while preserving quality of life. So, if a bone density scan shows osteopenia, don't be afraid to ask a few important questions. Ask, what is my overall fracture risk, not just my T-score? What does my FRAX score tell us about my chances of experiencing a fracture over the next 10 years? What lifestyle changes could meaningfully improve my bone health? And if medication is recommended, what benefits should I realistically expect? And how long should I take it before reassessing? Those questions can lead to a much better conversation. Because good healthcare isn't about treating numbers on a page, it's about treating people. And the best medical decisions happen when patients fully understand both their options and their risks. That's especially true after age 65, when maintaining independence, mobility, and quality of life become every bit as important as the test results themselves. Before we finish, there's one important thing I hope you take away from today's video. This is not about avoiding doctors, and it's not about saying no to every test. Many screenings save lives. Many medical treatments are incredibly valuable. The lesson is simpler than that. Every test should have a clear purpose. Because after 65, finding more problems doesn't always mean living a healthier life. Sometimes a test finds something important. Other times, it starts a chain of appointments, procedures, and anxiety that never improves your health at all. That's why the most powerful question you can ask may be, how will this test change what happens next? If the answer is clear and the benefits outweigh the risks, the test may be worth having. If the answer is uncertain, it's reasonable to ask more questions, take time to think, or seek a second opinion. Remember, medicine works best when it's personalized. You are more than a scan result, more than a lab number, more than a diagnosis on a chart. Your health decisions should reflect your age, your goals, your quality of life, and what matters most to you. The goal isn't to have more tests. The goal is to make better decisions. And that's a conversation worth having every time a new test is recommended. Your action plan. Before your next doctor's appointment, remember these 4 questions. What are we looking for? What happens if we find it? What are the risks for someone my age? Is there a less invasive option? Those 4 questions alone can help you avoid unnecessary tests, procedures, and stress. And if a decision doesn't feel urgent, it's okay to ask for time to think or get a second opinion. Good healthcare should never make you feel rushed.